Soy el TikTokero, hago más TikToks que un tortillero y ahora hago gorditos.
Y gordos también.
Y a los gorditos los hago.
Más flaquitos.
¿Cuál es tu historia? So tell us your story.
Entonces yo pesé 314 libras, bajé a 300 libras.
So my weight was 314 pounds. I went down to 300 pounds.
300 y eso fue por puro esfuerzo, comer dieta muy estricto y
So
no fui
this
muy
was with a
contento.
very strict diet, and I wasn't very happy.
Después había la opción para empezar con las inyecciones de semaglutida para bajar en peso.
Then later on, I had the option to go on semaglutide injections to lose weight.
Y empecé a bajar en el primer mes unos libras, como 4 o 5 libras.
And I started losing weight on the first month, about 4 or 5 pounds.
Y ya tengo más de un año y
And
ahora,
it's been over a year now, and now
ahora peso 56 libras menos.
my weight is 56 pounds less.
Estoy
Wow.
muy, pero muy contento.
And I am very, very happy. ¿Y has tenido algún efecto adverso? Have you had any side effects?
No, casi nunca. Había
No,
un
almost
día,
never. There was a day
un día después de una boda yo
that
comí
after a wedding,
bastante más de lo que
overate.
debería uno y me sentí un
I
poco
ate more
mal
than I
ese
should,
día.
and I didn't feel good that
Fue mi
day.
culpa, no.
It was my fault.
Entonces, no, estoy haciendo esto sin sufrir, muy contento.
I'm doing this weight loss without suffering, very happy now.
Es muy sencillo.
It's very simple. ¿Y lo recomendarías a la otra gente?
A
Would you
todos,
recommend this?
todos,
I would
sí.
recommend it.
Me salvó la vida, ahorita estoy viviendo más, mejor que antes y
It saved my
Ah,
life. I'm
sí.
living better than before
sí,
in every way.
voy a vivir muchos más años y
I'm
vivirlos
going to
mejor.
live more years and living better now.
De hecho, ahorita estoy viviendo bastante mejor, estoy surfeando, estoy en el agua, nadando.
So right now I'm living a better life. I went back to surfing, I'm swimming.
Ahora, si estoy corriendo, si estoy jugando tenis, lo hago sin dolor, sin problema.
Now I'm running, and if I'm playing tennis, I can do it without pain.
Toda mi vida mejor.
Everything in my life is a lot better. Wow. So his life is better. Your life should be better too. The semaglutide injections are incredible, and you should benefit from it. We also offer Terzipatide. With Terzipatide, you lose much more weight, about 22% of your weight of your current weight. You can lose over 34-week period. And with semaglutide, you lose about 15.1% on previous studies, up to also 37 weeks. But now there's new studies, like I mentioned recently, that increasing the dose of semaglutide to 7.2 milligrams instead of the approved 2.4 milligrams, you can obtain much higher weight loss. About 50% of the patients had weight loss over 20%.
Wow.
And this was done on diabetics and non-diabetics. So this is incredible. And then what happens when you achieve your goal weight? What are you gonna do? ¿Qué vas a hacer cuando ya llegues a tu peso ideal?
Imagino que me voy a quedar un mes, tal vez 2 meses más en el mismo dosis para formar bien el hábito de no comer demasiado.
I think I'm gonna stay on the same dose for a couple of months, just so that I can form a habit and not to keep eating. Y después, and then
Y después de eso, cortarme la panza, hacer tamita.
and then I want to get my tummy tuck. That's good. It's important. That's the only time that you cannot have these medications, the GLP-1 agonists, is 2 weeks before surgery. 1 or 2 weeks before surgery, we want to stop it because your stomach during surgery needs to be empty. And these medications give you a half full stomach at all times. So we don't want you vomiting during surgery. That's basically it. But you can resume it a week or 2 weeks after the surgery. So that's great. And what we recommend is that you go on a maintenance dose afterwards so that you keep your weight off, because you could potentially regain your weight. 3/4 of the patients that stop the medication regain weight. So we recommend a maintenance dose. It could be just a once a month kind of dose, much lower dose, but that's highly recommended. So, I mean, you could usually after 6 months of being on the medication, you form a new habit, like you were saying, and hopefully you can maintain that. But oftentimes these medications are for life, especially in diabetics, but also non-diabetics, you can just go on a lower dose. Thank you.